Drain care innovations, better comfort, less infection. Have you ever wondered how drain care can make your recovery smoother and safer? Let's talk about the latest innovations in drain care that focus on comfort and reducing the risk of infection. Surgical drains are tubes placed during or after surgery to remove excess fluid or blood from the wound site. This helps prevent fluid buildup that can delay healing or lead to infection. Basic drain care is essential for a successful recovery. Surgical drains usually consist of a flexible tube connected to a bulb or reservoir. This setup collects fluid and creates suction to pull it away from the wound. Before handling the drain, proper hand hygiene is a must to prevent infection. The drain site and tubing need to stay clean and dry. You should empty the drain regularly, typically at least 2 to 3 times a day. This helps maintain suction and prevents fluid buildup. Keep an eye on the amount and color of the drainage. As you heal, the drainage usually decreases and changes from red to pink to clear. Now, let's look at some innovations that improve comfort. Modern drains often use closed suction systems. These systems feature soft, flexible tubing and bulbs that can be securely pinned to your clothing. This design helps avoid pulling on the insertion site, making it more comfortable. Techniques like stripping or milking the tubing can help prevent clots or blockages. This involves gently squeezing and sliding your fingers down the tubing to ensure smooth drainage. Regularly changing dressings around the drain site keeps the area clean and contributes to comfort. Patient education is also a key part of drain care. Knowing how to empty the bulb and strip the tubing can help you manage your drains confidently at home. This knowledge reduces anxiety and discomfort during recovery. When it comes to reducing infection, closed drainage systems are a great option. They minimize exposure to outside bacteria compared to open drains. Using sterile techniques during drain insertion and dressing changes lowers the risk of infection. Monitoring for signs of infection is critical. Look out for increased redness, swelling, foul odor, or unusual drainage color. If you notice any of these signs, contact your healthcare provider right away. Advances in materials like antimicrobial-coated tubing are being explored to further reduce infection rates. For practical applications, wash your hands thoroughly before touching the drain or changing dressings. Empty the drain reservoir at least twice daily, even if it is not full. Measure and record the amount and appearance of drainage to share with your healthcare provider. Strip the tubing several times a day to prevent clots and blockages. Keep the drain bulb pinned to your clothing to avoid tension on the insertion site. Make sure the drain site stays clean and dry, changing dressings daily or more often if they become soaked. Always watch for signs of infection or increased drainage and contact your surgeon if these occur. Follow your surgeon's instructions on when the drain will be removed, which usually happens when drainage decreases to a minimal amount. By following these care steps and using modern closed suction drains, you can experience better comfort and a lower risk of infection during your recovery.